thank you for that response, Joy. It reminds me of this physics class I took as an undergraduate. It was called Color and Images. And it just really exposed me to how a lot of things in our reality are just wavelengths. Um, and that was just mind-boggling, eye-opening. Um, so my next question is for Lucas. How do the MD, or can both of you actually, so for Joy and Lucas, how do MD, PhD, and research-only tracks differ in daily life? So how do those paths differ? And I think the difference is that Lucas is an MD, PhD.
Yeah, I can speak to the training as well as like what is common to is there like a little bit of an echo in my voice or is that just me?
No, not just you. I'm not sure where it's coming from though.
Okay, I'm not sure what I can do, but
Mute.
I'll just try to ignore the sound of my own voice, even though I hate hearing myself on on audio. Um, Yeah, so I can speak to the training. Basically, I of all the MD PhD programs that I'm aware of in the US, it is 2 years. So medical school is 4 years, right? Your preclinicals and your clinical years, and then basically they sandwich the PhD in between. So you do your first two, like you learn about the theory, you learn about physiology, you learn about patho, you learn about histology, all those things and all you go through all your organ blocks and then your class that you spend a lot of time with, they go on to their clinicals and you go to the lab for 3 to 4 years, and then you come back and then you come back to your clinicals with a completely new class and everyone's young and you're old and but you have a PhD basically. So that's what the training's like. And for what it looks like in the day to day for an MD PhD, of course the NIH wants that 80-20 split where they would want people to be in academic medicine and for 80% of the time for them to be doing research. Research does take a long time, of course, and oftentimes it takes a lot of time just because you're not even doing the science, but like you have to do grant writing, you have to organize the lab, you have to, do a lot of that managerial thing, bureaucratic things. And then 20% you're like in the clinic. That's what the NIH would want. There's of course exceptions to that because everyone's a little bit different. And it's like, Joy just mentioned she had a friend who's working in industry. So there are people that go to industry. There are people that do startups. They remain in academic medicine. I have several contacts here at my institution where, um, they still do academic medicine. They still do research. Sometimes maybe they do clinic. Uh, and then, they have an idea for a startup. They have an idea for, starting a company. So that's an option as well. So it really is how you make of it, I think. And I think, I mean, I even know of MDs who who do a lot more. They do maybe do a couple of days in clinic and then they spend the rest of the time doing entrepreneurship, or they spend some time doing consulting, or they spend some time, it's really actually a very good degree because medicine is very broad. There's a lot of things that go into helping people to have better health and preventing diseases that aren't just like, okay, here are your pills, right? So there's a lot of, in the healthcare system in the US, in, innovating now with AI coming on the scene. So, I go to conferences and I see MDs really just working on like a very, very broad spectrum, and MD PhDs as well, although mostly are focused in academic medicine.
Can I ask you a follow-up question, Lucas? I know I'm not the one
Yeah.
host, but I was just curious what your step timing is with the
Oh,
MD
okay.
PhD.
Yeah, no, it is different across different institutions. I was talking to a friend at Michigan. I think they take step back to back. So they do step one, step two, I think in their
Mm.
third year after PhD, which sounds really terrible. Because like you're 3 to 4 years outside of the classroom and then you got to do step. I just took step last November.
Okay.
And so I took it, we do step, with after we finish our preclinicals, and then we
Yeah.
do step two after coming back. So I'm gonna have to keep up with my Anki cards over
Yeah.
my PhD,
Yeah.
which was not bad because there's only like, 100 cards that I have to do every single day.
Right.
Um, you guys will all, once you get to medical school, you'll understand exactly what we're talking about. There's a lot
Right.
of memory that has to go to, and you have some tools, and I'm using some, vocabulary that will be very familiar to you once you get there. Uh, but yeah, so I took it a little bit early, and I'm actually doing some early clinical rotations just because I wanted
Okay.
to get in the clinic before, and then I'm going to go to my PhD.
Okay. And for context, I'm not sure what the exposure is to all of this, but the STEP exam are the board exams that you take while you're in medical training. You take
Hmm.
step one right after your first 2 years. Typically, it's meant to see what your foundational knowledge is like. Step two is more clinical application, ideally after you've gotten some clinical exposure, but depending on what your program is, timing might differ. And then step three is taken at the end of your first year of residency training. So
Hmm.
that's the shadow that's lurking over my head right now.
I just had a friend who took step three and he was complaining about it. It's like a couple day long test, I remember.
Yeah, it is.
Yeah.
And perhaps it's worth highlighting just how much test taking is integral to medical
Oh
education.
yeah.
It is truly something that follows you for the rest of your life. Even when you're done with residency training, you're going to have to take a board certification exam to have licensure in the field that you're in. And you're also going
Hmm.
to have to continuously renew that license every couple years. The range of years differ depending on the specialty, and you need to stay up to date to have an active license to practice in the US. The beauty of that being that you ideally are staying current with the new medicine, the new research, the new innovations. That way you are practicing evidence-based medicine, and taking care of your patients based on the standard of care across the country. But then, of course, the downside to that is that if you are not good at test taking, it can be really difficult to succeed in medicine. I have worked with people in med school who did not pass STEP and they had to remediate and take it again. And I
Mm.
have a friend who did not bother and he just decided to do something else, got a master's, and now works for the sports team in the University of Michigan. Is probably making more money than I am. And so there are many ways to go about this, but if you want to succeed in medicine, it's going to be really important to build good study skills and learn how you take tests and maximize that for the rest of your life.
Absolutely. Yeah, I would add to that just to say if you're the nervous type, the more anxious type like I was, uh, you got to figure out how to get over that. Like you're taking tests like for the rest of your life, um, to be able to stay up to date, right? To be able to continue that licensure. If every single time you have those panic moments, you got to find like also psychological sports psychology, like be able to figure that out because it's not going away.
No.